It's next to screen share.
Okay, there we go. All right, so we are recording this session. This is structured as a regular Zoom meeting. So everybody has the power to unmute and talk. So we do ask that you keep yourself muted unless you are, part of the conversation in a way that is respectful, right? But we do encourage engagement. Joyce is the host of this session and I'm the moderator. So I will be looking at the chat box, making sure that if you have questions or comments and they don't, there's not a moment to sort of raise your hand and ask to talk, we will get to them. I am delighted to say that our host is Joyce St. George. I'm Julia Reichel. I'm the co-chair of the Catskills Addiction Coalition. Sorry, hi. We have 3 sheriffs and a professor of criminal law with us today. So actually, I'm sorry, George, you're not a sheriff. Can you tell me your actual title? I'm always messing that up. So I'll let you introduce yourself too.
Yes, George Tortorelis. I'm an investigator with the Greene County Sheriff's Office. However, Sheriff Pete Kusminsky is on the call as well.
Oh, whoa. Okay, so we might ask him to chime in if necessary. And we have Sheriff Craig Dumond from Delaware County here. Craig, can you just say hi real quick?
Good morning, everybody. Happy to be here.
Awesome. And we have Sheriff Juan Figueroa from Ulster County here as well. Juan, if you would pop in and say hi, that'd be great.
Good morning, everyone. And this is my 3rd conference. I'm excited to be here again. Thank you for all.
We're happy to have you. And Simon, if you would introduce yourself a little bit, Simon Purdy, I don't have your title perfectly either. So please introduce yourself and tell us who you are and what you do.
Oh, that's fine. Thank you. And thanks for having me. My name is Simon Purdy. I'm an assistant professor of criminal justice at SUNY Delhi. And I'm also the program director for the entire criminal justice program. So I'm probably the newest member of the county community here. I've lived with my family here for about 3 years. So I'm glad to be getting involved in your group. And I look forward to working with you more in the future.
And Joyce, if you would introduce yourself and tell us sort of what your plan is for the discussion today, that would be great.
Sure.
Before I start you though, I do want to tell folks that we will have an evaluation form for this session and a certificate of attendance that you can fill out. I'll be putting those links in the chat. And a reminder that this topic is going to be a hot one. The issue of law enforcement and addiction and recovery and how we support each other is a really important one in our communities. And so we do ask that everybody enter this room with respect and willingness to be engaged and to hear stuff that might be upsetting or that you might not agree with, but to be engaged and respectful anyway. And we really appreciate your participation. It's these kinds of conversations that really move the needle for all of us in our community. All right, Joyce, I'm going to let you take it away.
Thank you. I'm Joyce St. George. I'll introduce myself in a second, but I want to introduce the day or the session. So everybody knows that the deaths of Breonna Taylor, George Floyd, and so many others really illuminated the rift that we have between police and their communities. And all the protests we witnessed over the summer really led us to pay way more attention to what's going on, not only nationally, but locally. To add to that, the Governor Cuomo mandated that police departments in New York State create community police reform committees. I don't want to go through the whole name, it doesn't matter. But committees that would look into how police departments are doing if they are, excuse me, meeting the needs of their constituents. And so this meeting, this session right now is a wonderful opportunity for us all to hear what's been going on with these committees. And I am so happy that Sheriff Dumond, Sheriff Figueroa, and Sheriff Kusminsky and his crew have decided that they would join us. We need to hear from our committees. We need to hear from our officers and their leaders and hear what they're doing. The other thing I am so happy to do is to invite Simon Purdy, who is a criminologist at SUNY Delhi. And so we not only will get boots on the ground perspectives, but we'll also get the perspective of an academician, somebody who studies this, somebody who understands this, and somebody who has a background in examining police community relations. So I'm so thrilled. And I thank all the participants, and I thank all of you. We really do have about 50, almost 60 people signed up for this. So it seems that people are interested in what's going on right now with police and communities. What I'd like to do, we only have an hour, and I don't want to hold up the sheriffs because I know that, you know, as soon as I get off, I know Sheriff Dumond's going to be, his desk is going to be piled up, as is Sheriff Figueroa and Sheriff Kusminsky and his representatives. So I want to try and get as much done as we can. If we could, I'd like to hold off on questions for a little bit. What I'd like to do is offer some time to each one, only maybe 10 minutes for each department, to talk about what they're doing right now on police reform, on addiction and mental health. And the reason that we're looking at addiction and mental health is because those are two of the big issues that are coming out of all of these committees. And you hear it nationally, that there's not enough help for police regarding addiction services or mental health. So I'd like to make sure that we're going to give each department enough time to explain what's going on, to talk about their committees, how they're working together. And if you could throw in some other issues that you're tackling, that would be great. But again, we really want to see what's going on with addiction and mental health. So I thought we would start with Greene County because there are so many of you here. So can I get Sheriff Kusminsky and George Tortorelis? And I already forgot the other person's name. I'm so sorry.
Captain Tracy Quinn.
Captain Quinn, thank you. So maybe, Sheriff, if you could maybe introduce the other guys, but speak a little bit about your role in the committee and your perspective on what's going on right now and some of the ideas that you're coming up with.
All right, good morning. First of all, good morning, everybody. Can you hear me?
Yes.
Okay, what we're doing with the committee is we just had our 5th meeting. We have all our stakeholders involved, and we are heavily involved with mental health and the MCAT, which is a mobile crisis assessment team. And I think we're making progress, reaching out to all assets or all parts of the community and attempting to make connections that we may not have had the opportunity to do before this committee started. But we do have several programs going, and that's why I brought Investigator Tortorelis on board. He could talk about our Impacted Citizens program, which is somewhat modeled after Ulster County's Oracle program. And I also have Captain Quinn on the line, who is heading up our team on the police reform committee. So she could speak about that as well. So without taking up too much time, I really appreciate the ability to be here and to be participating in your efforts, and hopefully we can all make a difference in the communities we serve. So with that, George, if you'd like to start.
Sure, thank you, Sheriff. Good morning, everybody again. And I'm going to talk about the Impacted Citizens program, and then Captain Quinn will talk a little bit more about the justice reform, which I think kind of the Impacted Citizens program is also a portion of that. So it is modeled a little bit after Oracle, Ulster County. It's definitely a watered down version of what they do because we just do not have the resources, both financially and personnel wise, to do a program as large as they do. What we do, we have, when we receive an overdose call, we usually get a notification from the 911 center that there was an overdose. very limited details on what it was or if it fits the criteria of what we need. But after we research the incident, what we do is an officer such as myself will go out dressed in non-traditional police uniform. So like today I'm wearing a sweatshirt with a logo on it. And that's typically what we'll wear. We'll go to the home where the person lives that overdosed. If some of the criteria is they were not transported to a hospital or mental health facility because of the overdose. So we respond to the residents anywhere from 24 to 72 hours later. And what we do is we offer them assistance, try to see what kind of issues they're having, what they might need, what they overdosed on, and then set up some kind of program with them. What they do is if they agree, they sign a permission form, which allows me to forward their information. I work closely with Mental Health Association of Columbia Greene, which is, they also have a mobile crisis unit called MCAT. We work with them. We put the victim in touch with them. They will call the victim and then set up and decide what kind of services may be necessary. So whether it's transportation, that's an issue for them, counseling, inpatient, outpatient, whatever, we have a varied menu of what, how we can help them. We have found the program to be very helpful and well received. We're operating about a 90% success rate. And what I mean by success rate is how many people actually sign up that we have contact with. So out of the people that we actually are able to locate, because sometimes we cannot locate people because of the transient nature of the individual, or sometimes it's an individual that's just visiting the area and not living here. We're not able to communicate with them. But of the people we do communicate, 90% of them do sign up. We have not had any negative interactions with anybody. So even the individuals that decided that they maybe did not need help or didn't want to go any further, they were happy for the outreach. And then there were individuals that had been in programs that had kind of fallen off their program, and they have rejoined those programs. So that's how we're operating this. You know, there's obstacles to everything, and part of our obstacle is actually getting the information of the person that overdosed. We do have all the local law enforcement agencies, state agencies involved to forward us information when they have an overdose, but it's not always, we don't always get that information promptly. So a lot of times it takes some research on our end and footwork to identify the person who overdosed. That's pretty much our program in a nutshell. Again, it's kind of a watered down version of what Ulster does, but it has been very successful. And I think the personal connection, especially now with COVID, of us physically going and speaking with an individual that overdosed, I think is a great help to them. I can see where people have become frustrated. Even people that want help and attempt to get help, they run into a lot of obstacles such as transportation, or even just simply reaching somebody on a phone could be difficult. And they just kind of get frustrated and stop doing what they're doing. So I think the personal connection and us helping them connect has been very helpful to our impacted population here.
And how about Kathy Quinn?
Yes.
I'm here. Hi, good morning. So like the sheriff said, we just had our 5th PRRC meeting, the Police Reform and Reinvention Committee. Some things regarding mental health that have come out of it is that they really want to focus on having standardized mental health training across the board for us and for the local municipalities. So we're definitely focusing more on bringing in mental health professionals to our annual training and then opening it up to the other local law enforcement agencies. COVID made that a little difficult because we couldn't have large group gatherings, and we've always had a little bit of a component of how to deal with mental health calls in our annual training. We're just trying to get that a little bit stronger and get a little bit deeper into how we deal with specific calls. We also have crisis intervention team members that are members of the sheriff's office. So we're focusing on building that, getting some more of our guys trained in CIT. And we also started with Katie Oldakowski from the Mobile Crisis Assessment Team. She's a huge help when we need any direction on how to deal with mental health calls. She's opened us up to the HERO program, which is helping every responder overcome. So that if you have a law enforcement officer that's maybe struggling with something, you know, they can learn how to deal with it better, so that if they're in a stressful situation, they might be able to better handle that. So those are a few of the things that are coming out of the PRRC that we're working on growing and collaborating with mental health.
So what's the role of the community in all that? How does the community work with you on these sort of things?
For the PRRC, you mean?
Yeah.
We have community members are on our what makes up the board. The sheriff is actually the only law enforcement member that's on the board for the committee. So the rest of the committee are just, you know, members of our community that are weighing in on how we operate and how we deal with certain things, and kind of giving ideas from, you know, just civilian population as how we can better do our job and better handle certain calls, and going forward, how we can, you know, grow and expand what we offer to the community.
Wonderful. Wonderful. Thank you, guys. It sounds exciting what you're all doing. Let's get everybody to talk about theirs, and then we'll come back with more questions and more time for you guys. Sheriff Dumond, would you like to go next?
Sure, Joyce. I'd like to thank everyone for having me this morning. It's wonderful to be here and to be able to participate in a good event. You know, the more heads together in making a decision, the better. Always, I constantly tell the members that work for the office and our stakeholders and our other law enforcement agencies that it doesn't matter what color uniforms we wear, what shoulder patches we have. We're all a team and we work together. And that extends to our collaborators in the communities that operate all these wonderful programs and the resources that we rely on a daily basis to help us do our job more effectively. So thank you, Joyce, and thank you for hosting this. At the sheriff's office, we're ready to, let me start at the community or the police reform initiative. We are getting ready to have our third meeting on Monday. We have a fairly robust group, I would think. I believe there's like 15 or 17 members on that group from a wide variety of disciplines and backgrounds. We went as far as I'm concerned. You know, I can't speak on behalf of the entire committee. I'm just one member, but I certainly can't speak on behalf of the chairwoman. But I would say that I believe as a member that we went far beyond what was required as far as membership, and expanded to a wide variety of disciplines beyond what the executive order requires. So I'm happy about that, because like I said earlier, the more heads in the game, the better the outcome. We've initiated one survey so far to our community. I believe, based on what I'm reviewing from the other committee members, I believe another survey is going to be coming out shortly. Monday's meeting is going to pretty much be a result, I believe, from what I can tell, a report out from the subcommittees that were developed as a result of the main committee being formed. So look forward to Monday's meeting and seeing where we're going next. What we've identified so far, I think, is what everyone's talking about, and the reasons why we're here today is, you know, we have some major problems. You know, everyone does. It's just not unique to Delaware County. I don't want to, or Greene or Ulster. It's a statewide, it's a national issue. You know, the issues with mental health and substance abuse, they're occupying a lot of our time. So I think that's probably primarily three of the areas that we're going to be looking at as a committee. Some of the things that I can speak specifically already what I'm working on at the sheriff's office to address some of these things. We're looking at a renewed partnership with the Delaware County Office of Mental Health to look at a formalized referral program between us and the mental health department in the community that will that will really reach out to the individuals that may not normally be considered for services. So when we're talking mental health, generally we're dealing with 941 situations, people in mental health crisis. Well, there's a lot of times we encounter people in the community that may not meet that that threshold, but they should be receiving some sort of assistance or help with the problems that they're having. So this will be a formalized program that'll actually be a vehicle to enable that. So we're pretty excited about that. We're going to expand the recovery coach program that we have currently in our corrections facility, and we're going to be bringing that online with the patrol deputies as well. So there will be recovery coaches available that the patrol deputies can also refer folks to while they're out in the field, which I'm very excited about. And even though the corrections facility isn't part of the executive order, everything is intertwined, and we had what I believe is a wonderful Vivitrol program that's helped many inmates in our corrections facility with their addiction problems. Generally was a partnership with drug court and probation. We're going to continue that partnership, but we're also just going to expand that into a general program here that we administer at the jail as well for people that may not fit the category of drug court and probation. So we're going to try to capture a little bit larger of an audience with our Vivitrol program. Community outreach, we have a robust community outreach program. We offer a variety of services here at the Sheriff's Office. It's been somewhat, hampered by the COVID situation, because we can't be going out and doing the public presentations and meeting with groups of people like we normally have, but we continue to do that the best way possible through social media platforms and whatnot. But a couple of things that we're gonna expand upon are our youth. I've said since 2012 I've been a member of the substance abuse panels. Went around with people, the recovered individual to make public presentations. And one of the things that I've always said is we're not going to rest our way out of the situation when it comes to the substance abuse program. It's going to be, if we're going to make a difference, we're going to do it through education, and we're going to do it through education of our youth primarily. It's going to be a generational shift. And I strongly still feel that way. I've been saying that since 2012, as I said earlier. So we're going to initiate a law enforcement explorers program here at the Sheriff's Office, and we're going to target our at-risk youth in our community. And we can do that through identifying our youth through our partnerships with the school systems, through DSS, and through Delaware Opportunities, to really target those youth, bring them in, and give them some pro social things to look at and do, as well as give them an idea of what law enforcement really does here in Delaware County, because there's some preconceived notions, especially with our youth, what cops do. Whenever I give a presentation, when I ask them, the first thing they say, well, they arrest people or they write tickets. And everyone that's in law enforcement knows that the wide variety of the majority of the work that we do on a daily basis is not that. It's just simply helping people. So we're going to help educate the youth in that endeavor. And the other thing we're also considering is a citizens police academy. So our adults that are in our community that have an interest in what's going on at the Sheriff's Office, let's bring them in. Let's give them comprehensive tours. Let's give them an education program to show what the men and women of the office do on a daily basis in service to their community, and give them a different perspective on the work that's done on a daily basis, much like we plan on doing with the youth program that we're going to start. So I'm excited about all those things. We're going to be talking about those things in our police reform committee meetings. I will, and we'll see what the committee wants to do. Thank you very much. I appreciate it, Joyce.
Thank you. Lots of stuff. Okay, Sheriff Figueroa, bring it on home.
Well, good morning, everyone, and thanks for having me here today. And I also want to say hello to the sheriffs that are on the line. And it's a unique job. I'm starting my third year. I will say that, this is Ulster County. We have two committees. One's a task force from the legislature, and then the other is the governor's 203 that the county executive appointed individuals, which I'm on and the district attorney is on. And it's been a unique, really a unique time for law enforcement. If you think of everything that's going on, from bail reform 1, bail reform 2, budget cuts, the pandemic, the opioid epidemic, and it's just, law enforcement sentiment. It's just been a rough go for law enforcement. But I always look at the positive side of it. And I think interacting with the community is always a huge and important thing. And yes, we have programs like the cadet program here. It's been in place for quite some time. We've actually hired 2 African Americans from the cadet program that are full-time deputies here now in an effort to diversify this office, which is one of the things that our community wants. And it's important to diversify because it really shows that we are part of this community and we look like the community. We also are training on de-escalation, implicit bias, and we're setting measurable goals. One of the complaints that a lot of folks in the city of Kingston and African Americans and Latinos were complaining about is the way we stop folks and say that it smells like marijuana in the car. And so we decided that we were going to make a form. So every time that type of stop occurs, we're going to actually look and see how many times there was marijuana in the car and how many times there weren't. And if there weren't any, then obviously there's some training techniques that we're going to put in place for those individuals that made those stops. And these measurable points that we're putting in, I think is very important, and that's what the community wants. And so we're willing to do that. We started it. It was actually our idea, and I think it's a positive issue to both things I just spoke about, which is diversifying the office and then meeting the public. We've had numerous meetings since the executive order came out. We just had our last town hall meeting last night, and so it's been working. We have a lot of input from the community, and we'll see what happens with the end result that we submit to the legislature in April. But it's been going well. And it's a partnership with the community, with the district attorney's office. And we're very careful. This is one very important point I want to make. When we look at criminal justice reform, it's not just law enforcement. We got to look at the district attorney's office. We got to look at the judges and how they rule in their cases. And when we look at the juries, is it really a jury of their peers? Most African-American Latino communities don't have driver's license, don't own homes, and don't vote. And that's how we get the majority of our people that are on juries. So we also talked about how civil service works and how it really ties the hands of the sheriffs and the chiefs of law enforcement. So that's a quick down and dirty on what's going on with the criminal justice reform here in Ulster County. As far as our response to the opioid epidemic, look, we started this in 2019 in August. Oracle started. We rolled it out. We had a trailer that was donated to people who donated money from their family members from family members that lost loved ones. They wanted to be part of this. And so we started it. And the first part was educating and making people aware of what to look for in their homes. So we take that trailer out. Of course, we didn't do it this year because of COVID, but we take that trailer out to the festivals, to the county fair, and it was very, very successful. We Narcan trained over 400 people at that time when it was out, and then we give resources to family members who don't know what to do because the stigma that's associated that we all know about when it comes to this affliction, and so we went to the second phase of that, which is the team that we have that actually goes out. We set up a 1-800 number. We're going to put an app together. So local law enforcement has been sending folks to the sheriff's office to get trained, and then they're responsible for their own areas, and they contact us. And more importantly, when I first became the sheriff, I put in for a COSOP grant, which I didn't get the first time around, but although it's not public yet, we actually got that. And for the first time, we're going to embed a social worker, 2 peer advocates, and an administrative assistant. We're in the process of hiring them now, and we're going to put that out to the public once we hire that team. We're really, really excited about that. So think about that. For the first time in law enforcement here in the Hudson Valley, we're going to have people embedded with law enforcement that's going to tailor a program to the family and the individual. And it's mainly toward opioid epidemic, but it could be anything. It could be alcohol. It could be, cocaine. It could be any addiction. And we're really, really excited and proud of what that program is. We also have a MAP program here. So even if you, the first part of that is, even if you were off that prescription because you went back to the drugs and you end up at the county jail, well, we're going to go ahead and put you back on that program in the jail. And so the MAP program, the second part of that is, even if you don't have a prescription from a doctor, and that's going to start next year, or actually sometime this year, whereas you come in and we know who you are because you're going through detox, and we're going to offer you the different programs like we have, whether it's Vivitrol or methadone or Suboxone, and we're gonna follow that up with another big issue that we have is the housing issue with these folks. What triggers them when they go back? We all know when they leave jail within 2 days, a lot of them overdose and die. So we're lucky we have Family of Woodstock here. And that grant that I talked about also includes CIT training for the entire county. And that's huge. We started already that training last year. We're going to continue with every single agency in this county, and we invite those of our surrounding counties that if they want to send people, that they can send people to this CIT training. So that's it in a nutshell. There's a lot more, but I don't want to really take up a lot of time. But I want to let you know all the exciting things that are going on here in Ulster County.
Excellent. Thank you so much. Wow. It's interesting, Sheriff Figueroa, that you talked about that it's not just about police, it's the criminal justice system. The entire system needs to be revamped. I think that's pretty evident. And police are really the front line. It's who people see. And I think that they take an awful lot of the burden for the whole criminal justice system. So one of the things that I'd like to do is invite Simon Purdy, professor at SUNY, to look at the big picture. You heard the three sheriffs and their representatives about what they're doing to alleviate at least mental health addiction. But this whole movement about bringing people in and having them become more participative in with the police, I think is something that's going to keep going. So, Simon, can you talk a little bit about your perspective on what's going on and, how police and community relations is doing?
Yeah, absolutely. And thank you again, Joyce, for inviting me to this. So, the one thing, and I just looking at the history of law enforcement and the CJ system in general, it's never been static, right? There tends to be a lot of resistance to change. We get set in our ways and it's hard to change. But I am so excited to hear all of our sheriffs and law enforcement members here on this call talk about efforts to actually make changes, because we know law enforcement has changed dramatically, since its inception in the United States and much more since its, early days. But ultimately, this is an ongoing process. So if we continue to work with our communities, it's incredibly important, right? Because the needs of our communities change on a regular basis. So the responses from law enforcement, from DAs, from our CJ system in general has to also adapt to those changes and those changing needs. One of the things I was really happy to hear were from Greene County there, talking about individuals who come into contact with the sheriff's office there as victims, right? Not as people who are potential criminals. That is the kind of cultural language shift, right? I'm a sociologist by training, so I talk a lot about language and symbolism. So this idea of shifting how we talk about people, and I know this is becoming more consistent, talking about people, for instance, who have mental health issues or substance abuse issues as victims, as opposed to they're being arrested as for criminal actions, and that we are there to help and support instead of punish. That's a huge shift. And I know it's been ongoing for quite some time, but this is one which I'm hoping really catches on, especially in our current moment. That it's not just about treating individuals who come into contact with law enforcement as criminals, but as people who probably have some underlying issue there that needs to be addressed. The other thing that I really like, Sheriff Figueroa, what you mentioned, talking about things, for instance, like housing assistance or housing status. We know there are underlying causes here for all of these issues, right? So for addiction, obviously housing, stress, income, these things have a big role to play when it comes to addiction, when it comes to mental health, and oftentimes the lack of being able to get help for those things. So if all we're doing is addressing training, of officers, that's great. Don't get me wrong. But if all we're doing is saying we'll train our officers correctly, but the community still has those deficits, right? It still has individuals who are living in situations where it's really rough. We're not going to overcome those issues, no matter how many law enforcement officers we throw at it, no matter how well trained they are. The other thing I really like from this conversation is this idea of setting measurable goals. I'm a researcher, and it's one thing to say, here, we're going to do this. That's great, right? Let's go ahead and do it. Let's train the officers. Let's get these new programs going. But unless we can actually see whether or not it's made a change, we can assess these measurable outcomes. So like the, marijuana report form that Sheriff Figueroa was talking about, whether we're talking about, tracking arrest rates, whether we're talking about tracking overdose rates and comparing those to points in time where we've made these changes, I think that's going to be something we have to follow up with. So this committee work, right? There's a deadline for all these committees. I'm sitting on the one for Delaware County. There's a deadline of April 1st, right, to submit these policies. And I know Sheriff Dumond has talked to us about this. He hopes it goes beyond that, right? And I hope it goes beyond that too, because it's not just, here's 9 months, we're going to work on this, and then poof, all these problems are going to be gone. We're going to continue to have these issues. Maybe the policies we come up with, the changes we make, they don't solve everything. So we got to address it on a regular basis. So I'm hoping and very happy to see that this seems to be the movement, that there's a lot of effort to keep working on these things beyond just these initial committees. And I think if we can have elements of our sheriff's office, of our local police departments, even larger criminal justice system elements like talking to court systems, legislatures, et cetera, we can definitely continue with these conversations, because I don't want them to just end after these committees are done. So I love this conversation. And the other big thing I want to point out is, again, this cause and solution thing. I teach students about this all the time, right? We go on and become police officers. We have to understand what the causes of the problem are, right? If we don't understand the cause, we can't ever come up with a solution that works. So, it's one thing to come up with an idea. That's great. I want to try as many of these ideas as possible, but unless we're trying to identify the cause. So doing continued research, right? Reaching out, for instance, I would offer my help to anyone who wants to perhaps, look at their communities, try to learn more about the communities. I'm a social researcher. I would love to help, right? So whether this is assessing whether a program works, whether this is, surveying community members, interviewing community members to see what are the issues, what's going on here. I think that's a very important step as well. So we have to continue looking for these issues. They might not be there, right? And I've said this numerous times in our committee. These problems might not be there. We might not have a huge problem with racial bias, but if we don't look for it, we'll never know. And if we don't know, how can we do anything about it? So ultimately, I think this effort, this conversation has to be ongoing. And I really appreciate everyone here who is, putting out these great ideas. So thank you again, Joyce.
Thank you. Thank you so much. I'm so glad you're here, because you were able to really put it in a more global perspective. And that's exactly what we need right now. So I have a question for you guys and for the panel. We're talking specifically about addiction and mental health, but what really triggered this entire project was bias. And for many people, they hear bias and they think race. And bias can be anything. You can have a bias toward vanilla ice cream and a bias against chocolate ice cream. Bias is just something that you either favor or don't favor. And with policing, you can have all the training you want. I did training in policing de-escalation techniques for 37 years. If an officer chooses to not use those skills that they learned because of bias, it doesn't matter how much training you do. And so there's bias racially, there's bias. I look at city people versus local people, how we look at addiction, how we look at mental health, all of that is influenced by the way that we view it. So I'm curious about not your best officers, but all your officers, and how you work with them to let them know that bias is really the gateway. If they're not going to let the skills go through, then they're going to have a different interaction with a person. So I'm just curious with, excuse me, with the sheriffs. how do you work with officers or deputies that maybe you have concerns about with bias? Anybody could jump in.
I'll start it, if that's okay, because I recently had an issue here that we're presently looking at. And I think it's always important to understand our roles in society and the importance of what we do, and as personal responsibility and as a law enforcement officer, our responsibilities to the people that we work for, which is our community. And when you look at videos and it's an 8-second skit and it shows one thing and then you see the entire event, it really gives a whole picture of what goes on, and you can see the narrative. And not that I never look at things to say who's at fault. Instead, what I do is look and see what we can do better. And this last incident, it's definitely something that we can do better. I was in the Marine Corps for 22 years, in the state police for 25 years. I've met a lot of people with different attitudes and concerns. And I looked at my pay stub and it never said I get extra money for having an attitude. So I say that because that's the reality of humanity. There are certain people that react to certain situations a certain way. And you can do all the training that you want, but until that person gets in that situation, you're not going to know. And that's why having measurable forms to fill out are extremely important in this. We're also going to do that for de-escalation. So once these officers get trained with de-escalation tactics, if they're used, we want them to fill out a form that they use a tactic. Were they successful? Were they not? And so measurables are, I think it's something that we need to start because we all have biases, every single one of us. I could tell you so many of them. I was an investigator working with the Special Investigations Unit. And sometimes because the traffic was really bad leaving New York City, that we would go to a basketball game and I would park my car in a secured lot. And then I would get online to get the car back, and an older couple, white couple, would come to me and hand me their ticket. And I'd look at them, I'm like, well, what kind of car is this? And they're like, well, it's a BMW. I'm like, well, you can have mine. It's a Ranger pickup truck. And they look at me, you don't work here? I'm like, no, I don't. But I know that they're not racist, and I knew they felt appalled, but I also have a sense of humor. And we need to know what, what implicit bias is. And I've been doing that literally since I've been here at the office. Little tidbits of information to folks that work here so they could see what it is to be a person of color, because when you don't work with people of color, you don't really understand them. And so that's why it's important to diversify the office, extremely important, especially when we have the city of Kingston that this office is actually located at, and the issues that the city of Kingston Police Department has with the people that they serve. So I hope that answered your question.
Very well. Thank you. The Sheriff Kusminsky, I'm looking at you. Do you have a?
Joyce, we have a couple raised hands.
Oh, you do?
Yeah, so I'd like to let them talk. Is that cool?
Let me just get the answers from Sheriff Dumond and Kusminsky first, so that they may be able to fill in some of the blanks.
Okay, and then we
Okay.
will hold on Dottie and Alexis's questions. Okay.
Thank you.
So, Joyce, if I may, I would have to agree with Sheriff Figueroa that it really is something that you don't know it until you experience it. And just the interactions we've been having as a result of all of this, some of our deputies are hypersensitive to it. For example, one of them stopped a young woman of color, and she actually put her hands out the window, was shaking when he approached the vehicle. Just that experience alone mortified him. He sat with her on the side of the road and spoke to her for 45 minutes just in order to calm her down. But that perception is something we have to get through and deal with somehow. And it's horrifying for all of us, because none of us want anybody to feel like that. This is something we all have to take on a day-by-day basis and hope that we could just bring those officers to recognize the fear that may be experienced by somebody that we deal with. So with that in mind, it's going to take time, and we're going to have to keep, I know the training isn't everything, but we are watching for signs every day. And just this heightened awareness, I think, benefits us a little bit.
Excellent. Thank you so much. Sheriff Dumond, do you have anything?
I do. I got a few different things we've been working on here at the sheriff's office. We've implemented a robust implicit bias training program, and we're making that part of our annual training program that will be updated on an annual basis with the up-to-date standards in regard to our not just that topic, but our accreditation status as well. We have a body camera program, and I like what Juan said about measurable outcomes, because, you know, when you have a body camera and like what Juan said, and you have an entire video, there are no mistakes really. You can look at that and really come to some conclusions pretty quickly on what's happening. So we're going to be instituting that with our supervisors, and they are going to be reviewing. There's going to be body cam, random body cam reviews where we're going to be looking at those videos, and if retraining or if other direction can be made, we're going to make sure that we do that in the interactions with folks out there. We're also going to be pulling some of our service calls from our 911 center and just sending out random surveys to people in regard to their contacts with the deputy and how that contact went, and doing those things as well. And then last but not least, and I don't want to take up a lot of time here, we're working very strongly with the New York State Sheriff's Association to revamp the civil service system around the testing and qualifying of deputy sheriffs, and actually we're advocating for police officers across the state as well, because the current civil service system completely hogties us when it comes to diversifying our agencies. And if the state really wants to help us make a difference in this, they really need to get off their hands once and for all, and change those civil service standards so that we have a bigger pool of candidates we can choose from, as well as disqualify from. You know, there's people that are on the list that it's obvious, due to whether it be a psychological evaluation or a background investigation, should no longer qualify to be on that list. And civil service doesn't allow us to qualify folks for those reasons, which is very unfortunate, especially in the times that we're living in now. We've been working on that just recently through the New York State Sheriff's Association and the Department of Civil Service. And we're optimistic that because of the situation that we're in right now, we actually may be able to make some headway there. I don't want to jinx it and say that we are, but I'm cautiously optimistic based on the last conference call that I was on, that we're going to make some headway with civil service, and that would go a long way at diversifying our agencies.
There's a question. Do the officers have a debrief period?
What do you debrief? You'd have to explain that. I don't.
Debrief.
Hey, Joyce, I'm sorry, but there are several questions.
One of the questions?
Joyce, there were several questions that came before that question that I would
okay.
really like.
I thought that was one of the first ones.
No, there are two people who have been waiting with raised hands for a while now, and I'd like them to go first.
Yeah, can you
I can do it.
Okay.
All right. Alexis, can you unmute yourself and ask your question?
Yeah, sure, no problem. Thank you so much. So I have a question. We know that arrest and incarceration increases the risk of fatal overdoses for people who've been arrested and incarcerated. We hear consistently from most sheriffs that we can't arrest our way out of this problem. And so I'm curious, I've seen a national movement with DAs and sheriffs making a decision to no longer arrest people for low-level drug offenses. So like possession seventh, just simply not making those arrests, or in the case of the DAs, not pursuing prosecution for those types of cases. And I'm curious how many of our sheriffs on the line today have made similar commitments in their communities.
Anybody?
So we do not arrest individuals if they are, they overdose and there's drugs with them when we show up. We just don't do that. We destroy it or take it into evidence and have it destroyed, but we don't arrest them for that. Even the folks that are dealers, we will arrest them, but if they're users, we'll get them to rehab as well. And then we'll work with the district attorney's office and the county court judge and let them know that they're in rehab, and they take a look at that and decide whether or not they're actually going to get sentenced. Remember, we are also responsible for getting this stuff off the streets. And if there's a bad dose of fentanyl out there, which happens a lot here in Ulster County, I think we're over 400 last year overdoses and about 48 fatalities, which supersedes 2018, and it's all because of COVID. So it's a major issue here in the county, but we don't arrest for low level. If you're a user and you were overdosed, we just don't do that anymore here.
I appreciate that, but actually I was not asking if you make arrests as a result of an overdose. I'm just asking simply, are you still arresting people for low-level drug possession charges, misdemeanor 7th, regardless of whether there's an overdose or not, it still causes harm to the person, whether they overdosed first or not?
Well, we still are making those arrests because it's the law, and our job is to uphold the law. I mean, I understand your question and where you're coming from, but there are instances where family members come to us and they end up in the county jail, and it saves people's lives as well. And so we can't, one size doesn't fit all. And unfortunately, there are still laws that we have to uphold.
Other sheriffs? Yeah,
My
if I
response?
may, we are working with Schoharie County on a LEAD program, the Law Enforcement Assisted Diversion Program, which deals with just that. I mean, like Sheriff Figueroa just said, we are mandated to enforce the law. So currently we are still making those arrests, but we are also working on a LEAD program to deal with the potential of moving some of those arrests to some other type of treatment. We also do use the drug court for that, which is very active in Greene County. So there are ways that they can be diverted from the criminal justice system that we are using currently, and we'll continue to move in that direction. Unfortunately, COVID has stopped us from most of the meetings we were scheduled to have for our LEAD program, but that's a work in progress.
And I'd just like to jump in, as Sheriff Figueroa said, sometimes somebody ending up in jail saves their life. I'm the sister of a heroin addict, and him ending up in jail for 8 months actually turned his life around. I strongly feel that he wouldn't be here anymore if that didn't happen to him. So just one person's perspective.
And I think that's great. And I think that that human element between law enforcement and with folks that have these problems are really important. I want to also add that even if they are arrested, like the sheriff said, the court system with drug court, there's obviously a huge difference between what a criminal is and what an individual that's breaking the law, that's doing it because he's addicted. And that's a huge culture change in law enforcement, in the DA's office, in the courts. And I think that's great for all of us.
I think I'd like to move on with the other questions only because we're getting very short on time.
Yeah, actually, I want to jump in about time. We can probably go like 10 minutes over, Joyce, if you can do that. I think you're the limiter on that.
It depends on the sheriffs.
Yeah, if the sheriffs are willing to take a couple more questions. Otherwise, we have to stop pretty much right now.
Okay.
Yeah.
I think we're good.
Okay. All right. So I'm gonna ask Dottie to ask her question, and then I would like Alexis to clarify a little bit. But I want to make sure I get Dottie in. Dottie, go ahead.
Hello, I just have a couple of questions, and I just want to, or one question actually, and I want to kind of stick specifically to science-based treatment for addiction, which is psychotherapy, harm reduction, down titration, and social sustainability. And I would like to know if the officers are in the front line coming in contact with these people, what resources are they using to give to these people? Because I can tell you right now, Delaware County, with a needs assessment in 2016, the county clinic specifically said that they do not have the resources to take care of everybody. So with that said, what outside resources, I mean, it just doesn't have to be Delaware County specifically, but I'm pretty sure every county is struggling with this. What resources are the officers providing these people suffering?
Sheriff Dumond, do you feel like fielding that?
Well,
What kind of resources do we have in Delaware County?
well, as Dottie has indicated, the resources are limited. You know, they're very limited, and we're hoping that we'll be able to enhance some of these resources as a result of maybe some of the discussions that come out of the reform committee meetings. But you know, we have like I said, we just recently we've increased our recovery coach options to include not just the jail, but with our patrol deputies as well. So those options are there as well. You know, and to go back to what Alexis was saying a few minutes ago, you know, one of the things I agree with my fellow sheriffs, both Juan and Pete, that everything that they said, I don't need to for the interest of time not to repeat it, but the officers also do have they do have discretionary power, and they you know, for the most part, from what I can tell and see, officers apply that discretion appropriately, and I'm not the only police officer out there that believes that there are two different tracks out there. There's a dealer track and there's an addicted track, and those two tracks need to be handled in different manners. And so I'm very confident as far as the members that I have working for me, that they are making those referrals and they're doing everything that they can that's available. But as Dottie said, the availability sometimes is a hindrance.
Yeah, Julia, do you want to jump in, because you have a lot of resources that you know about in Delaware County that a lot of people don't know about, and we've been developing it with the coalition.
Sure. I mean, and Craig is a partner on some of the grants we work on. We worked with Oracle. And actually Greene County has also worked with us as well. We have several certified recovery peer advocates that are stationed in Delaware County now. We're in preliminary talks with the Delaware County Sheriff's Office for referring to those resources, including one who is really focusing on families, people who might become pregnant, people who have young children, people who might be being trafficked, folks who are in need of support in a system that really stigmatizes them so much that they don't seek even basic prenatal care. This is because Delaware County has one of the highest rates of neonatal abstinence syndrome in the whole state. That's a problem that is systemic. It's because we stigmatize parents who are pregnant, who also are using drugs or who are on Suboxone so much that we take their children away pretty much when their kids are born. That's not really great for them or the kids, and causes a ton of damage, especially in the case of medication-assisted treatment, which is the responsible way to be treating a substance use disorder. But there's a lot of misinformation and confusion about Suboxone actually being bad or just another thing like heroin. So that's why we have a neonatal abstinence syndrome peer. She just started, and she's at the disposal of the sheriff's departments and the deputies, and we hope to build those relationships. That's all I'm going to sort of say for now. I want to let Alexis talk a little bit more about just the data about arrests. And I'm going to mute myself.
Awesome, thank you. I appreciate each of the sheriffs' willingness to answer. And as Sheriff Dumond mentioned, there is discretion that every police officer uses and exercises as they perform their duties, and they make decisions every single day about which charges they want to bring against a person as they are actively on duty. So I would certainly implore you to consider not bringing charges forth for criminal possession 7th, because it's the lowest level, and it's an easy thing to ignore and to let it go. And it really only complicates people's lives when these charges are brought against them. And certainly officers' discretion could be utilized in those situations. And we are seeing this. This isn't something that I'm suggesting that's really far-fetched. We are seeing this nationally as a movement that sheriffs are making these decisions and giving these directions to their officers. And we are seeing DAs across the country choosing not to prosecute under these laws. And then the other thing I would just really encourage, I'm happy to send out the data. There are countless studies that show incarceration increases a person's risk of death 40 times for the first 2 weeks post-release. And that percentage, that change never drops down to less than 12 times more likely to die of a fatal overdose post-release prison after 2 years of incarceration. So that's whether they're in jail for a week or several months or several years, their risk of dying from a fatal overdose never drops down to being less than 12 times the person not incarcerated. So even though we have these little success stories of, hey, I know Joe, jail saved his life. Joe is an exception. Joe's not the rule. The rule shows that more people die as a result of being incarcerated than not. And that's what we have to hold to, not these little success stories that we hear of individuals, but what does science, data, and statistics show us? It shows us that incarceration increases a person's risk of death. Like I said, I'd be happy to send those studies. I would really encourage our sheriffs to go ahead and use that discretion that you have on the streets to not prosecute these low-level drug offenses.
So I'd like to answer that. First of all, we don't prosecute, we put them into the system. And there's liabilities involved that we let people go if they're driving a car, if they've had family members and something happens and we just let them go. Some people call us that are complainants. It's our duties that we actually have to do something, not only by law, but because we have to, there's liabilities that are involved with that. And just to touch base on what you said about the jail, I agree with you. And that's why I have a MAP program. You got to think, these are not little successes. These are huge successes to bring a medical assistant treatment program into the jail, where there are some people that are denying that they even have addictions. And we know who they are because they're going through withdrawal inside our facility. And when they leave, we follow them out up to a year. And it's been successful so far. We have a long way to go, I agree. But law enforcement now, when they show up, even to when they go to a dealer's and they do an arrest and there are users there, we're getting them to rehab. That never happened before. These are huge cultural changes that law enforcement is doing. I dedicated my life to go after the business side of the drug dealer. The reason why I'm so compassionate about this is because I remember what happened to my family during the crack epidemic. And it's different now. And law enforcement is different. And these are huge bounds that we're doing. I'm a practitioner. I see this every single day. Data is great, but I believe in reality, and reality is what works, in particular in neighborhoods like mine.
I think we need to wrap up.
We do.
It's
And
a shame
unfortunately,
because we're right in the middle of this wonderful discussion.
This is a conversation that we really appreciate having. We don't all agree, and that's okay. You know, that's like none of us agree about this. Even all the different sheriff's offices have slightly different approaches to how to deal with this. But the fact that we can come together and at least have this conversation is a huge start. I find it heartening that mental health seems to be sort of an easier lift for a lot of law enforcement. There's less stigma attached to mental health, right? There's more of an understanding that it's really not the person's fault. It's not a moral failing. Addiction up in here is just a real, it's hard, man. We have a hard time not judging people who have addiction issues. Okay, I want to thank everybody, particularly our sheriffs, also our audiences, our questioners, our commenters. This stuff is not easy, as I said at the beginning, and often we just avoid having the conversation at all. We did engage a little here, so that's great.
I just want to say one more thing. I mean, besides thanking, Simon and Craig and Juan and Pete and George and Kathy. What I want to say is the one thing we didn't talk about is linking policing and the criminal justice system with mental health and with treatment. And I think that there are still, and also other community services that can help. And I think that that's one of the things that we sort of did not get time to talk about, but that's one of the big pieces. We spend more money on policing than we do on mental health and on addiction. And yet police are the ones who have to pick up all the pieces. And I think that what we have to do and what we have to advocate for is a way to allow professionals to come in. And I think Sheriff Dumond was talking about getting recovery coaches to sit with and work with deputies. These are the partnerships we need. And I think that we're heading in that direction, but I think that we have to do more work. So if, there are many people who came and attended this, I hope, and I know so many of you, but I hope that you are all involved in the communities, and no matter what you're doing, whatever your interest is, it can lend itself to partnering with police in some way, because police touch the lives of everybody in your community.
Absolutely.
So
They really
I-
are. They're holding the bag for all of us. And
Yeah.
that's it's too much. You know, you can't ask an officer to have all of these skills and also enforce the law. It's not fair. So hopefully we can build more support and structure and more funding for programs that are evidence-based and dignify people with autonomy and that kind of thing. All right, I'm going to wrap it. Joyce, thank you
Thank
so
you.
much for convening this and for getting everyone to participate. Simon, thank you for joining us.
Thank you.
And I'm going to remind folks that this session has been recorded. It will be available on our website. We are also having 2 more sessions today, one at noon, which is hosted by Dr. James Anderson at Bassett Health, which is a sort of support group for providers who are prescribing buprenorphine. Craig, you might want your prison doctor to come and join, because it would be a cool thing for him to talk to. We are also having at 2 o'clock a play about addiction and a session afterwards with a panel hosted by Arnie Schwartz. And then that wraps our week of conversations about addiction. We are so grateful for all of you. Thank you so much for your participation. I've dropped links to the evaluations in the chat box. If you want to save the chat box, you can by pressing those 3 dots and then saving it to your local machine. Tell us how we can do better. Tell us what you liked and what you didn't. And I think all these sheriffs are open to continuing this conversation. I know they've said that to me privately. I really appreciate that. It's important.
As is Simon.
And Simon too. Sorry, Simon, you're the odd man out. So we'll be watching, and we hope to keep on having sessions about this. Diana suggested that we have a subsequent session about linking police with mental health resources, which I think would be great. What, Juan? Go ahead.
Just send everybody's email out to everybody, because there's some folks I wanted to follow up afterwards.
Sure. Do you want me to share? You want me to put your email out to the public?
Absolutely.
All right, I'll do that. Craig and George and Jim, are you cool with that? Craig's okay. These sheriffs are sending their emails out. Lucky, great, awesome. Simon, do you want to do
we're
that
good.
too?
Yeah, absolutely. That'd be great.
Okay, cool. All righty, I will do that.
Me
That's
too.
and Joyce. All right, I'll send a follow-up email with contact info for everybody who was a panelist. Thank you guys for doing that, and we'll continue the discussion.
Thank you so much.
Thank
Have
you.
a great day, folks.
Be safe, everyone.